Hello, everyone. Today, I would like to discuss the topic, the truth about hepatitis B in children. Trying to answer the question, why should newborns receive the hepatitis B vaccines? My name is Jesse Kodia. So first, what is hepatitis? It's basically the inflammation of the liver. And that can be triggered by heavy alcohol use, toxins, some medications such as overload of acetaminophen, and germs like viruses. In the United States, the most common hepatitis virus are hepatitis A, B, and C. For the purpose of our presentation, I would like to discuss more on hepatitis B virus. It comes from a family of viruses called the DNA hepatnaviruses. And the virus is very infectious. It can actually survive 7 days outside the body. So which means within 7 days, it has the capability of causing an infection. And according to statistics, it's been shown that over 4 million people are having a lifelong chronic infection. And that can lead to scarring of the liver, such as cirrhosis, can lead to cancer, it can lead to liver failure, and even kill the individual. How does this virus move from one person to the other? It's spread through blood, fluids, from an infected person, and a mom who is infected with the virus, hepatitis B virus, can infect the baby. It's also been documented that children get infected during nursery and while in the hospital, especially when they are being taken care by an infected healthcare professional. It is worth noting that hepatitis B is not spread through food, water, sharing utensils, coughing, sneezing from an infected person. When the virus gets into the body, it actually leads to elicit an inflammation or the immune system mounted an attack, which if the immune system is able to overcome it, it eliminates virus. And if it does that within less than 6 months, it is called the acute hepatitis B infection. And if it lasts more than 6 months without being eliminated by the immune system, it leads to a chronic hepatitis B infection. So the question is, why hepatitis B vaccine important to our children? From research, and according to the CDC, the chances of getting infected depends on the age. And it's been shown that 90% of infected babies and 50% of infected young children will become chronically infected. And that can lead to complications, as we discussed earlier, cirrhosis and sometimes cancer and even death. In contrast to adults who less than 10% of infected adults will develop the chronic hepatitis B virus. So how are we going to protect our babies? It is very important that we allow our children to receive the vaccine. It is recommended that the newborn receive the 4 doses, 3 to 4 doses of the vaccine. Young children who are not vaccinated, and people who are taking care of our children, including the health workers. So in conclusion, I want to emphasize that, yes, hepatitis B vaccine is safe according to the CDC, and a little side effect of soreness at the injection site, which is the most common one. And like any other medicine, it could get some little problem, but it is extremely, extremely very low. So thank you so much for listening to my presentation, and I hope we get our children protected.